about what pain management is before we get started talking about hips and backs. So my job here is to help people that come in and have pain and they don't know where the pain is coming from or why the pain is happening. And my job is to figure out where it's coming from, why it's happening, and then figure out a way to help you feel better. That can be through injections, through medicine, through physical therapy. They're all different techniques that we can use to help you feel great. And my job is to figure out what recipe will work best for you. So today, what we're going to talk about is something that has been confusing for doctors and patients for a long time, which is when you have pain in the lower part of your body, is it your back? Is it your hip? And why is it so confusing to figure out which one it is? So, a little bit of anatomy. This is my friend. I asked my son what we should call the skeleton when I told him we were going to be using one today. He said Skelly. This is precisely why we did not let my son name my dog. But anyway, here we have Skelly the skeleton. And I want to just show you, if you look, most people think that our hip is right where this big pelvic bone is. And I kind of thought that too for a while, and it took some years of med school and even a couple of years of residency to really nail down the fact that the hip is actually way down here. So this is where the hip is. And the back is most people have back pain, it starts up here. But the reason that people sometimes think it's their hip is because if you think this is your hip and you hurt up here, it's logical to think that, oh, my hip hurts. That's really not the case. When you hurt up here and you hurt in the back part of your body, it's mostly your back. If you sort of start hurting in the front of your body, way down here, that's going to be your hip. To make things even more confusing, sometimes when you get back pain, you get pain that starts back here and sends pain all the way down the front. So that also could be confusing because you think, okay, I know this now. It's going to be the hip because I'm feeling it in the front. Well, that's where things get tricky because sometimes if a nerve is pinched in the back, it sends pain right over the hip. So how would you know the difference even if you'd sorted out the fact that the hip was here and the back is back here? And sometimes we get pain in the butt. And that's kind of the mid zone between the low back and the hip. So that's where you're like, I don't know what this is. Is it my back? Is it my hip? And that's where you come to somebody like me and you say, Doc, I don't know what's going on. I thought it was my hip, but then somebody's telling me it's my back. And my job is to try and sort out the back from the hip. So yeah, those are my things. I don't know if anybody has any questions.
Thank you. And we do have some questions coming in. So one of them is, what types of injections can you do the same day? Can I just come in and have an injection if something's wrong?
The answer to that is sometimes. So sometimes we're able to do injections on the same day. The great thing about the setup here is that I'll evaluate you in the office, like in a room, something like this. We'll go through all of your MRIs. And then if it seems like you might benefit from an injection, I can take you right next door and use a C-arm, which is an X-ray guide to help do a nerve injection or an injection over some arthritis or even a hip injection that's quite targeted. But can I do that the same day? The thing that determines whether or not we can do that on the same day has to do with insurance. So if your insurance is one of those ones that allows for a same-day procedure, then yes, you can get one done on the same day. But if one requires what's called authorization, We would have to see you in consultation, and then I can do the procedure just as soon as they authorize it.
Thank you. When I get an injection, do I go under anesthesia, local anesthesia? What kind of pain is there?
So this is a good question, and probably one of my most frequently asked questions. Sometimes before I even get to sit down, somebody will go, "Doctor, I'm supposed to be getting an injection today. Is it going to hurt?" And I'm like, "Hi, I'm Dr. Cherrick. Nice to meet you. Before we talk about your needles, let's figure out what's going on." But to answer your question, I give a lot of local anesthetic. Sometimes we have the opportunity to use other medications. Sometimes if needed, I can give you medications beforehand to help relax before the injection, but most people tolerate injections with just local anesthetic. I use a lot of it. You're awake and I speak to you the whole time.
Thank you. Somebody says, I was recently diagnosed with spondylosis. Can that be fixed without surgery?
Well, for those of you that don't know, spondylosis is a really fancy word for arthritis. So the question is not, can we fix the arthritis? Because arthritis lives in our body and it lives in many people's bodies. And oftentimes arthritis is not painful. When arthritis gets painful, we have certain injections that we can do to try and make that pain go away. And that would be a non-surgical way of trying to help the pain that's coming from the arthritis.
Thank you. Sure. Are there exercises that I can do to help treat back pain?
There are several exercises that one can do to treat back pain. Sometimes I'll give prescriptions for a home exercise program, but oftentimes what I like to do is have people go to physical therapy to get a home exercise program so that I have a trained therapist supervising them while they do exercises. I have done physical therapy myself and have been surprised by how many things I've done wrong thinking that I'm doing it right. So having the guidance of a physical therapist to get you started can be really, really helpful.
How many steroid injections can I get?
Wait, I missed the first part of the question.
How many steroid injections can I get?
So we have to be really judicious and really calculated when we are giving steroid injections, or really any kind of injection, right? Because it's still me putting a needle in your body. So steroids are really, really helpful, but we have to monitor how much steroid you are getting over time. And sometimes if you're having an acute flare, we're able to do a few injections back to back, and that's okay. But if you're somebody that has a lot of different joints that get injected often, we need to determine how many you're getting and how frequently. And it's not the same answer for everybody, but it is something that we take into account. It's one of the nice things about being able to work here, because a lot of times you'll be getting your injections from other doctors here, and I'll be able to see how many steroid injections you've gotten from one of my colleagues before we go ahead and decide if we're going to do steroid injections in your back.
Do TENS units help?
I find that TENS units, and those of you that don't know what TENS units are, so TENS units are units that send sort of this pins and needles feeling over certain areas of your body, oftentimes placed on your back. And all of the pins and needles feelings are supposed to overwhelm the brain so that the brain is distracted by the pins and needles and you feel less pain. TENS units work for some people, but they don't work for everybody. I don't think there's ever really any harm in trying one, but sometimes you can try one in the context of physical therapy before purchasing a home unit.
How does someone know that they should come see you?
Well, I think that anybody that has an ache or a pain that's bothering them should feel free to come see me, because It doesn't mean that you're going to get a shot. It just means that we're going to figure out why this thing is bothering you. So I think if something is persisting for longer than a week, or you're not able to manage it through what you normally do at home, sometimes people take Advil, sometimes people use ice. If you've tried all the things you normally try and your pain persists, it's worth seeing somebody like me to try and figure out why it's going on so long and why it's not responding to the typical treatments that you do at home.
Thanks. I have 2 herniated discs in my cervical spine that seem to only be getting worse. Do you treat this?
First, I'm sorry that that's going on for you. And secondly, yes, I do treat that. It's certainly something that we can look at together and figure out how you can be helped.
Earlier, you talked about pain going down the front of your leg, but what if the pain runs down the back of the leg into the calf?
Pain that runs down the back of the leg into the calf is usually coming from the low back. Even if it goes into your butt and you feel like it's kind of part of that hip area, it's really one of the nerve roots in the low back that's getting kind of angry. Our job would be to figure out why that nerve root is getting angry and then figure out what we can do to calm it down.
Do you do trigger point injections?
I do trigger point injections. They can be very, very helpful for individuals that have muscle spasm.
What's the difference between piriformis syndrome and other hip pain?
Oh, good one. Like an advanced question. Okay, so the piriformis is a muscle that runs across your butt lengthwise. And sometimes when it spasms, it can actually send some pain down the leg. Now, what was the second part of the question? What the difference between that and?
Other hip pain.
So other hip pain or pain that would be coming from arthritis in the hip, usually you don't feel that as much in the butt. And when you have hip pain that's coming from arthritis in the hip, it's hard to walk. You can feel a lot of groin pain and you can have difficulty getting up from a seated position. With piriformis syndrome, you tend to have a lot of pain in the butt and sometimes pain that goes down the back of the leg. It's not usually a groin or front of the leg kind of syndrome.
Why is my back pain worse when I wear a belt?
I don't know. You should come in and I can talk to you about it. That is a question that requires a physical exam.
I have a pinched nerve and pain in the leg. Is there treatment for a pinched nerve?
There is treatment for a pinched nerve. There are ways that we can calm down. Sometimes the reason that pinched nerves are painful isn't just because there's something pinching it, but because the thing that's pinching it is also setting up a lot of inflammation in the area. So something that I can try and do is help calm down the inflammation that's causing that nerve to be irritated.
Is there anything that you can do for someone who has very painful scoliosis and also has sciatica nerve damage?
So scoliosis, which is a curvature of the spine, can be very challenging to treat. That is something that I really would need to evaluate you for. But because my background is in physical medicine and rehabilitation, and I specialize in musculoskeletal diagnostics, it's certainly something that I feel confident looking at and trying to figure out why your pain is happening and what we may be able to do to treat it. But it would be a more complex situation.
What can be done if I have both lower back pain and hip pain?
So first we have to sort out what's what. And then we have to sort out what's the priority. So if you have, let's say, hip pain, and we decide it's coming from arthritis in the hip, and that's making you limp, it might make sense for us to calm that pain down first and see if just by limping less and having a better gait, being able to walk more normally, your back pain resolves on its own. If it doesn't, then we might have fixed the hip or fixed the pain from the hip, and then we transition to targeting the back.
I've heard about ablations. Do you do these, and are they successful?
So yes, ablations, usually the full term for that is radiofrequency ablation. I do that, but I only do that after we've done a diagnostic injection to make sure that the nerve that I am ablating is the nerve that's causing your pain. So it's not something that you would come in and do right away. You and I would have gotten to know each other at least for a few visits before we decide to take a step to do radiofrequency ablation.
I had a cortisone injection in my hip yesterday. When I arrived at the facility, my hip only hurt when I moved it in a certain way. But since I received the shot, it hurts constantly. Is this normal?
This is normal. What happens is when we do an injection, sometimes the injection feels really good afterwards, and that's because we put numbing medicine in it. And then what happens is that numbing medicine wears off, but we've still had a needle in there at some point. And usually when we put an injection somewhere, especially somewhere that has arthritis or in a space that's pretty tight, we've added fluid to a place that hasn't had fluid in a while. So what can happen is you can get soreness after the injection, and the injection can usually take 2 to 3 days to actually start working. I would say though that if your pain is extreme or it's not better in a day or two, you should contact the person that did the injection to make sure that they feel like your course is in line with how it should be.
I was recently diagnosed with a slap tear by my surgeon, but I'm trying to avoid surgery. Is there anything you can do to treat this, or is surgery my only option? The pain is substantial.
It's hard for me to know. So first of all, I'm sorry that the pain is substantial. Without seeing you and without seeing the tear, it's hard for me to know. To be completely honest with you, in those situations, sometimes when people are looking for non-surgical options for things like slap tears, I often call in an assist from one of our regenerative medicine specialists who work in the sports medicine realm. They are sometimes able to evaluate a slap tear under ultrasound and let you know if it could use some regenerative medicine like platelets or PRP or prolotherapy to help heal the tear. But it is hard to know. Some of those tears are surgical.
What would cause me to feel like I simply cannot lift a leg using hip muscles when I am sitting? I can lift the right leg, but not the left leg, and it hurts to try.
That is, again, something that I would need to evaluate you for. There are several different things that can make our muscles weak. And the question is often, is it because the muscles themselves are weak, or is it because there's pain that's disabling us from using those muscles? And while that seems like not such a big difference, it really is. So that's something that requires evaluation to make sure that the muscles themselves are not weak, but rather that the pain is what's disabling you from using them.
You recently mentioned prolotherapy. What is that?
So prolotherapy is not an area that I focus in particularly, but it is a branch of regenerative medicine in which they use high concentrated sugar around ligaments and to help with healing.
I'm 76, and I recently had an MRI that showed a compression fracture at L1, and I'm trying to avoid surgery. Do I have options? The pain is awful.
You absolutely have options, though it's hard for me to know without knowing the degree of compression that you have. Also, as a side note, if you haven't had a DEXA scan to look for osteoporosis, that might be important in the context of a compression fracture. But I'm happy to have you come in and see me. We do treat compression fractures here, and sometimes I can do certain injections to help with the pain that's coming from the compression fracture. but that really needs to be evaluated with imaging.
Can back and hip pain cause numbness in your feet?
It depends. Hip pain that's coming from your back can cause numbness in your feet. Usually if the numbness starts in your feet and is going back up towards the back, that's not usually from the back. If you're having numbness in your feet and you feel like it's coming from the back and going down, that could be from the back. But if you have numbness that's just starting in your feet and going backwards, it might be a sign of something that we call neuropathy. And that's also something that we can look at if you come in for a visit.
I have stinging pain in my left shin, and my left hip has hip arthritis. Could they be related?
They could be, but oftentimes when the left, you said the left side. So oftentimes when you have hip arthritis, the hip likes to cause pain in the thigh. That's where the hip disguises itself. When we get all the way down to the shin, it's not often from the hip. It could be from the back, but also arthritis in the knee can refer to the shin. Or you might be having shin pain because of the way that your walking has changed because of the hip.
Is there a non-invasive treatment for spinal stenosis?
So spinal stenosis is, for those of you that don't know, essentially a traffic jam caused in the middle of the spine in which the nerves are trying to go through the spinal cord, but they get really squished at one level because either you have a disc pointing out, arthritis pointing in, or some combination of the two. Is there a non-surgical way to remove the traffic jam? Not often, but there are often non-surgical ways to try and help the symptoms that one feels from the traffic jam, so they may not need surgery. Cases like this are where I work closely with my surgical colleagues to determine what is best needed.
I have groin pain. Could this be associated with hip issues?
Yes, it could be, or it could also be back, but sometimes groin pain is from the hip issues. It can also be from other issues that can be happening in the back part of your pelvis as well.
What's the next step for back pain when injections don't work?
It actually kind of depends on what the cause of your back pain is. So sometimes there's medications, sometimes we try and think of other options. That's something that I work on with my patients very closely, and it really has to do with a personal level of care. There's no single recipe that I can use to determine that. I wish there was, right? Like this would be super magical. I'd be like, oh, okay, if we do these injections and they don't work, then we can just do X and poof. But it's not how it happens.
Would yoga help back and hip pain?
Sometimes. How's that for an answer? Isn't that annoying when people say sometimes? Like, sure, doc, sometimes it will. Sometimes when people have back and hip pain, I'm not too enthusiastic about them starting exercises that they haven't done before. Somebody who's experienced in doing yoga and that certain types of stretching, I feel more comfortable saying to them, try some yoga in this way or try in that way. But it's not something that I would simply do without getting evaluated first, especially if you're unexperienced in doing yoga prior to having the pain syndrome.
If I have a herniated disc, is it safe for me to exercise like biking or pickleball?
As long as that herniated disc isn't causing too much pain, then it is safe for you to exercise.
What kinds of problems cause radiating pain down your leg? Is it always nerves, or could it be the herniated discs in the back?
So herniated discs in the back are totally fine until herniated discs in the back start pressing on nerves. So a lot of times That's not entirely true. Sometimes you can have pain from just the disc, to be clear, but oftentimes saying one has a pinched nerve and saying one has a herniated disc it's almost synonyms. So you can have a herniated disc that can be causing a pinched nerve and sending numbness down the leg. I don't know if that exactly answers your question, but oftentimes when you have numbness down the leg, it's from a nerve that's being pinched in the back. There are other things that can cause numbness going down the leg, but the most common one that we see here is a pinched nerve in the back.
I have been told that I may need a bone graft on my hip. Would the graft cause back pain?
I do not know. I don't know. That is not a question I've gotten before.
I was diagnosed with a tear in the disc L4, L5. I have read that it should heal fairly quickly on its own, but I've had it for quite a while. Is that concerning?
The tear itself is not concerning. As long as it lives there without causing you pain, that's what matters.
Can injections be taken for excruciating pain in the groin/pelvis area?
Yes, as long as we make the right diagnosis. So we have to figure out why the groin and pelvis area is hurting. And if we figure out that the reason it's hurting is an area that I'm also able to inject, then we can help it that way.
Would you use heat or ice for back pain?
It's a little bit of choose your own adventure. Some people like heat and some people like ice. I try not to tell my patients that like ice to use heat and vice versa. I am one who personally responds a little bit better to heat when I feel like I have a muscle spasm, but when I feel like something is really, really painful and kind of sharp and shooting, I use ice. This is not the formula that works for everybody, but it is something that I use for me personally.
So someone says, I frequently have lower back and hip pain. In the past 3 years, I've ended up in the ER twice with agonizing and severe pain. They do x-rays, I get a shot, and I'm better within a day, and I go on. I do stretching occasionally, but not regularly. Should I come in for an exam or just deal?
So I think just dealing is not what I would want a member of my family to do. So my patients are sort of members of my extended family, like super extended now if I have a lot of patients, and everybody then gets related in a weird way. But just dealing is not something that I would recommend to a member of my family, so it's not something that I would recommend to you. It's never a waste of anyone's time to try and figure out why you're having these episodic, painful experiences. We should at least figure out why they're happening so that when they happen again, you don't have to necessarily run to the ER, but you can call myself or one of my colleagues to help you get out of the pain.
When a patient comes in for an exam, do you do x-rays?
It depends. For me, some people, it just depends. Some doctors like to have x-rays prior to seeing the patient. The way that I tend to do my exams is I'll examine you, and if we decide that you need x-rays, we can do them on site, and then I can review them with you at the visit.
Does sciatica cause hip pain?
Sciatica is a term that is often used to describe nerve pain. Some people describe sciatica as only pain that goes down the back of the leg, like in the hamstring and the calf. But if we're talking about sciatica and using it as another way of describing nerve root pain or radiculopathy, I know that's a fancy word, that's a mouthful, but if we're using it to describe nerve root pain, then yes, it can cause hip pain.
So does stretching in general, not necessarily yoga, but just general stretching help?
Yeah, I think movement helps generally. So yes, I believe that stretching helps.
Could osteoporosis cause back pain?
Osteoporosis in and of itself is not felt to be painful, but osteoporosis can predispose you to what's called compression fractures. We talked about that a little bit earlier. And if one has a compression fracture secondary to osteoporosis, that can be quite painful.
Is ice still recommended right after injury and then heat later on, or does it matter?
Yes, right after injury, ice is what I would recommend. For something that's more chronic, that's not as certain.
Thank you, everybody, for your questions. We are out of time now, and we will respond to you in the comments if we were unable to get to your question in the live. You can also head to orthovirginia.com if you have any questions or to see more information about Dr. Cherrick. Dr. Cherrick, would you like to close?
Yep, thanks so much for being here. It was great speaking with all of you. I hope you never need me, but if you do, I am here for you.